Okay. This time we'll call our OCHN board members, a board meeting to order. And at this time, please rise for a moment of silence and the Pledge of Allegiance. I wanted to take a moment this evening for us to remember those in Pennsylvania who were killed and injured, and the families that were affected. No matter what your political stripes are, that is meaningless. And those of us here in Michigan have seen that we've lived through several times in the last couple of years. And with the people of Pennsylvania, and at this time I would just like to take a moment of silence in memory of the person who was lost in those. Pledge allegiance to the flag of the United States of America, republic for which it stands. Please have a roll call of those members present.
Mr. Young. Here. Mr. Furman.
Present.
Dr. Giles. Pastor Jones.
Present.
Ms. Woodruff.
Present.
Dr. Hans. Ms. Newman.
Present.
Ms. Root did let me know she's going to be a little bit late.
Okay.
Ms. May. Here. Mr. Torres. Mr. Cowan.
Present.
You have a quorum.
Thank you. At this time, I would ask for a motion to approve our board meeting agenda and order of business.
So moved.
Moved and supported. Is there any discussion? All those in favor say aye.
Aye.
All those opposed? The motion carries. At this time, we have the first opportunity for public comment. Do we have anyone online who wishes to address the board?
If you are online and wish to speak to public comment, please raise your hand at this time. Salim, you can go ahead.
Thank you. Good evening. My name is Salim Kareem. I'm a program supervisor at New Gateways, a skill building program that has been serving people with disabilities for 32 years. Freedom Works Opportunities is a vocational program that may soon close down due to continued unsustainable rates received by OCHN. They have been providing services for 4 decades. They will be the 5th vocational program to close down because of funding issues in about a year and a half. People with disabilities rely on Oakland County's provider network, and yet OCHN continues to let the provider network collapse. After I commented on this crisis in the June 18th board meeting, your executive director spoke about it, but took no accountability. Instead, your executive director discussed how the state needs to do more. The facts tell us that the main problem is not the state. Here is one revealing fact. The PIHPs of the counties that surround Oakland County pay higher rates for day programs than OCHN, all of them. Please ask yourselves this. Why is it that OCHN chooses to pay lower reimbursement rates than the PIHPs of every neighboring county? Here is another revealing fact. All neighboring PIHPs passed along the state-mandated 85-cent wage increase for DSPs without nullifying it by taking away a previous increase. We're obviously not a poor county compared to any county neighboring us, and yet all their PHPs pay higher reimbursement rates than OCHN. How can neighboring PIHPs do this while working with the same state as us? Because the main problem is not the state. The main problem is that OCHN chooses to balance its budget at the great expense of people with disabilities and their DSPs. The people with disabilities of this county need OCHN to quickly begin providing sustainable rates. If not, the provider network will certainly collapse. This would be disastrous for the people OCHN is obligated to serve, and there would be no ambiguity about who is most at fault. The people of Oakland County are watching, and they will remember who stood up for our most vulnerable residents. Thank you very much.
Thank you. Is there anyone else who's online?
Anyone else online, please raise your hand at this time.
Okay, thank you. Is there anyone in the audience here in our building or in the meeting room who wishes to address the board? See no one, we'll close public comment. One item of board business we need to take care of is we did receive the written resignation of Jonathan Landsman, who has served this board for a number of years. And I've been advised that we should have a motion to accept the resignation, and then we'll be able to advise the Board of Commissioners that we have accept the resignation of Mr. Landsman and a support. Is there discussion?
Question,
Yeah.
clarification. Is that our normal practice? I can't remember when
Yes.
somebody resigns. Okay.
Yes, it is.
Thank you.
Yeah. This time I'll need a roll call vote for the motion to accept the resignation.
Mr. Torres?
Yes.
Ms. May? Ms. Newman?
Yes.
Dr. Hans? Ms. Woodruff?
Yes.
Pastor Jones?
Yes.
Mr. Furman?
Yes.
Mr. Young?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Okay, so we'll have, if you could, Sheila, if we could have prepared, and I'll forward to the Board of Commissioners the fact that a letter indicating there's been a resignation and a vacancy. And then I would urge anyone, we do have vacancy. I don't know if there's any current days on file with the Board of Commissioners. I'm not sure which position, because I know we all fit into different silos. I'm not sure which position that is. Do you remember? General? Okay. So it's the general. So if you have anybody you might want to think who it might be a member, you can tell them. To figure out, but if they need any help, let us know. All right. So next we have stories that inspire hope, and Trish Zembo is going to do the introduction.
All right. So I am really excited to introduce Cheryl Myers today. So I'm going to start off by first saying my name is Tricia, and this is Cheryl. Cheryl is a member of the training team and is a extremely strong advocate within our team and within our agency for our IDEA initiative, our inclusion, diversity, equity, and accessibility. And so today she is here to share her story. So, Cheryl?
Hi, everyone. Hi, everybody. So I will be talking today about deaf and hard of hearing communication and my recovery story as well, my healing story. Next slide. So statistics show that over 90% of deaf and hard of hearing children are born to hearing families. Many deaf and hard of hearing kids may not have access to sign language earlier on in life, and that can lead to language delays and developmental delays. So people also call it language deprivation. It's a similar term for the same concept. But that happens when you're born, which many hearing babies are born, but they pick up the audio around them, so they're able to pick up language, but deaf kids hear nothing, so they don't have the same access. Many hearing parents don't learn ASL to communicate with their deaf and hard of hearing children, and that causes social isolation within the family. The next slide. And I'll talk to you guys more about my experience growing up now. My mom found out she was pregnant with me, and she had rubella. I was born deaf, and I do have cerebral palsy as well. As I grew up, I was diagnosed with bipolar disorder in college, and I did go to an oral deaf ed program, and I learned sign language later on, and that really helped me to take off with developing my signing skills, and I was able to really just develop cognitively. I learned so much better compared to my oral program. It really was not a successful method for teaching deaf kids. But my school had forced me to use an FM system. So they were kind of like hearing aids, early hearing aids. But that really was not an effective method, which they found out later on for deaf kids. We really couldn't hear anything if you were profoundly deaf, but they were very heavy in trying to teach oral and speech and trying to lip read. But there was so much language that was lost. There was so much meaning and communication that was missing, and it was very difficult to communicate with hearing people. And next slide. So we would use lip reading, but that is not a very effective method for communicating with deaf people. For people who are born deaf, they really are more dependent on ASL for communication. English is really a second language for deaf and hard of hearing people. A lot of people misunderstand that, and it causes a lot of miscommunications when they don't have access to language early on. Next slide. So stigma and discrimination can cause a very unwelcoming environment. Deaf people can often feel very isolated and alienated. And I'll explain the term autism. What that means is that a person feels that they are superior based on their ability to act or behave or be a hearing person. And an example of that could be if you ask somebody to read your lips, even if they say that that's not their preference. Or it could be refusing to provide an interpreter when one is requested. So I think it's really important that we try very hard to make sure that we're equal and we're fair. Because if you think about it, 90% of all deaf kids are born to hearing families, so they don't have that same access, and it's a real struggle. And I know that even deaf people don't look forward to going to family events. Those can be a source of dread. And I was a part of that 90%. And I would have a lot of dread going to family events because there was no way to communicate. It was a huge barrier. My family didn't sign. They would only use speech, so I would watch them joke and laugh, and I'd sit there by myself, and I had no idea what was going on. I didn't know what they were saying. I felt very isolated. I felt very left out. It didn't feel very equal. Next slide. So we're going to be talking about healthcare barriers. We need more healthcare professionals who are trained with deaf and specifically in deaf and hard of hearing culture. There are very few deaf mental health professionals who are fluent in American Sign Language. or fluent enough, I could even say. So they need to be culturally competent and linguistically competent. So that is a tough situation. We struggle to find access to health care, and I can talk about my journey. When I was diagnosed with bipolar disorder, I had a very hard time finding a therapist who was fluent and who could understand my culture and understand how that influenced my life and my raising. Hearing therapists had no idea what that meant or what kind of influence that had, so I had a very difficult time because we weren't understanding each other. There'd be a lot of back and forth with no real resolution. I have found a good therapist since, and that therapist is a CODA, which means that is somebody who is a child of a deaf adult. That therapist understood very well my language use. That therapist understood how all of those things that I went through growing up influenced me as an adult, and was able to appropriately diagnose me with bipolar disorder, and was able to help me with my issues with my family and that lack of communication. So finding that therapist, finding that support service who is skilled with deaf and hard of hearing culture, especially when you're serving members of the deaf and hard of hearing community. There needs to be fluency in that. I really can't emphasize that enough. We really need more therapists who are competent both culturally and linguistically. The next slide. So ways to address those barriers. We can improve access to sign language, so that may mean taking a class, learning ASL on your own, going to deaf events, watching deaf movies, reading online about deaf culture. I do have resources for you guys for you to take home so that you can read that and keep that for yourself. It's really good educational material. The second is developing tools such as closed captioning and providing interpreters and using phone apps, or even workshops and meetings and, for therapy and counseling and other events when you're working with deaf and hard of hearing individuals. The third is to encourage inclusivity. We want to make sure that whether it's a social event or a professional event, we want to make sure there's no discrimination and barriers, and even with peer mentors. We want resources to be available to guide and support. We also want to create a culture of partnership and acceptance. And my fourth point is we want to increase social awareness within different organizations, different hearing people. We can invite families who may have deaf or hard of hearing children themselves. We can welcome them into the community. We can have a discussion with them about the different challenges that they may face with the deaf and hard of hearing community, because we need to advocate for their rights. It's very important that they have good access to mental health care. The next slide. Well, thank you very much, you guys. Did you have any questions for me? I hope that my presentation today was able to help you guys become just a little bit more familiar with the deaf and hard of hearing world and what we face and what kind of communication barriers we have.
Yes,
Are there any other questions?
we do, but first I want to thank Cheryl for coming. I'm sure there'll be a few questions, but we appreciate you helping us understand better the deaf world, and we most of all appreciate your work here. Thank you.
Thank you.
Yes.
My question was, how long did it take you to find a competent therapist?
It was a long journey. I went through many different types of therapists that were not competent. We really struggled with understanding each other. It was really difficult for me because I already had issues with my mental health. To be faced with more complications, more complex, more struggles, just everything was really tough. I would think that maybe it took about 10 years to find a competent therapist. That's why I really stress the importance of finding a competent therapist. That we just need more that are trained, because a lot of mental health therapists here in Michigan out here are not trained to deal with us. A lot of them are not competent linguistically or culturally.
Thank you.
Yes, Trish.
Can you share a little bit about all the things that you've done here at OCHN to help our agency and our staff with ASL and deaf culture?
Yes, I can. I did teach some ASL classes here at OCHN. I stopped because there wasn't enough people coming to those classes. I thought that wasn't effective for those people that were because of the lack of participation. But I was teaching American Sign Language here. I did teach, I did some trainings with law enforcement agencies. I taught them about different ways to approach the deaf and hard of hearing community. And I taught them some basic signs included in that presentation. What was really important for police or law enforcement to know and be aware of if they were faced with a situation where they did run into a deaf or hard of hearing person. And just even knowing a few signs would be able to help. You may not have a full complex conversation, but it would be helpful just to alleviate some of the stress in the interaction. I currently am serving on the DEI committee, and I have been helping provide information, and that's been really helpful. Is there anything I'm missing, Tricia?
Cheryl also presented at CIT International, which was an international conference hosted in Detroit to more than 1,200 people that attended that conference, and she was able to do her training that she does for our CIT. She's presented at CIT for, I believe, the past 4 years, maybe, if not more. I'm probably losing count, but she's trained hundreds of officers. So thank you, Cheryl.
Yes, Sarah.
I know that people in the deaf community often have a specific sign that they use for their own name. Would you mind teaching that to us?
Oh, yeah, sure. My name sign is CM on the chin. So if you do the letter C on the chin, then the letter M on the chin.
Thank you.
Thank you. And we decide name signs based on your personality. Your personality is basically how we assign those name signs. I gave Tricia her name sign because she smiles all the time. So her name sign is like this, looking like the T is coming up like a smile. So she already has a name sign. Are there any more questions?
I have one. So you've been on a journey. From the time you were a child to today, do you think the resources and support have improved, stayed the same, or lessened over that period of time, from your experience?
I would say we need more improvement. We need more work. I don't think, and I don't mean to say it, but what I've noticed is that OCHN really serves. I don't notice them serving the deaf and hard of hearing community. I'm not saying that we're excluded, but I don't see a lot of our people in my community coming here for services. We need to be able to help provide. If we provide better services, maybe we'll be attracting more people from the deaf and hard of hearing community here to provide that improvement in needed area.
Okay. Thank you. Anyone else? Again, I think I speak for our entire board. Cheryl, thank you very much for coming here tonight. I think we've learned a lot, and we appreciate the resources that you've mentioned. I've already checked a couple of them I'm going to follow up on. I'm sure others will. Thank you very much, and thank you for your perseverance.
And thank you all for being here. Thank you.
Next, we have the different reports. The board chair report. Been involved a lot with the audit review and some other behind-the-scenes matters. I know the CEO and I have some meetings with elected officials set up in the near future as we try to pursue additional funding. So that's it. I know tonight we have the audit on the agenda, and Mr. Young, as the vice chair, do you wish to make any comments from the Finance Committee perspective?
Just a couple regarding our cow meeting. Patrick Franklin was called away. Oh, he's gone. I was going to see if he would announce his special reason he was called away from the cow meeting, but we'll save that for later. Eddie provided an overview of the audit, which is clean. We're looking forward to hearing more details in a bit. Also talked about our year-end net position, which was $50,120,316. Eddie provided an update and overview of the May financials, which reflect a net position of $46,847,000. I'll note Medicaid revenue is up, but provider network expenses are up $22 million, leaving us with a current year-to-date deficit of about $4 million from where we started the year at. So more revenue is coming in, but provider network expenses are up substantially in the mental health and IDD areas specifically. So we'll get more on the audit in a little bit.
Thank you. And from Policy Management, Yvette Woodruff, please.
Okay. There was one item under Policy Management at the last meeting. Ms. Megan Phillips, the director for the SUD program, presented on some grant funding that the organization has received. And it is for incentives to keep people engaged in treatment to reduce the recidivism rate. They're going to be starting, I believe, in October with that. All of the cohorts will not start at the same time. They will roll out a couple cohorts at one time and, if necessary, tweak the incentive program. The incentive program will be through a value-based platform that the organization itself will not control. And people can earn up to $599 a year. And we know why that number is selected, so that you don't get into 1099s. And so we are excited and looking forward to see whether or not the incentive-based value program helps to retain people in treatment and helps with getting negative urine results. That's it.
Thank you. At this time, I'd like to call Eddie Brown from our finance staff and Mr. Kelly from BDO for our fiscal year end 23 financial audit presentation. And as I mentioned, we did have a little preview at our last meeting, but BDO is the one who signs the audit, so we'll let them speak this evening. But go ahead, Eddie.
Good afternoon, or good evening, rather. Eddie Brown here, introducing Jason Kelly, who's our senior auditor, manager over our audit engagement, has been conducting the audit for several years, and he has been the senior since the inception of his firm conducting the audit. And so, as it was already stated, I briefly highlighted some areas of the key points of what our opinion was, but Jason can go into a little bit more detail of, what he saw, what he reviewed, and if there was anything that stood out to him and his team. So I have before you Jason Kelly. Thank you.
Thanks, Eddie. Good evening, everyone. So today, we'll briefly go over the financial results of the audit. As part of the fiscal year 23 audit, we really have three different reports that we issue. We issue a report on the financial audit or the financial statements. We also are required to do a single audit, which is an audit over the federal awards due to the level of federal funding that OCHN receives each year. And then we also do an agreed upon procedure, which is a compliance examination, which is required by the Michigan Department of Health and Human Services every year. We can move forward. Perfect. So, as was mentioned earlier in the meeting here tonight, the ending net position of OCHN ended at $50.1 million at the end of fiscal year 23, which is about a $10.9 million decrease from fiscal year 2022. So that means that the expenses overall were $10 million higher than revenues brought in during fiscal year 23. OCHN does have approximately $5.48 million of outstanding debt at the end of fiscal year 23, and there was about $1.08 million of principal reductions on that debt made during fiscal year 23. We can move forward one slide, please. This is a little small on the screen, but this is a summarized statement of net position or balance sheet comparing fiscal year 23, 22, and then 21. I'll just note that it says as restated under 2021 up there. That was due to last year there was a new GASB standard, GASB number 87, that was adopted around leases, both for lessor and lessee. And as we present 3 years in this management discussion and analysis, the standard required to go back and implement that standard as of the beginning of fiscal year 2021, even though it wasn't effective to be implemented until fiscal year 22. So some of the changes or highlights, while that's flickering up there, to note on the summary statement of net position is current and other assets decreased about $13 million from fiscal year 22 to 23. The main driver of that decrease was the cost settlements and the due from other governments or due from provider amounts had decreased from 22 to fiscal 23. And then also there was, because of the deficit, some of the investments were liquidated into cash during fiscal year 23 to meet the operating needs. Fixed capital assets or the fixed assets, there was a small decrease, about $2 million there, and that was essentially due to normal depreciation of the assets. So when a capital asset is purchased, it is not expensed all in the year it's purchased. It is expensed over the useful life. So a piece of equipment, you may take the expense over 5 years, where a building, you may take the expense over 30 years. And then down in the liabilities section, the main changes there is the repayments of debt that I mentioned earlier, along with the other liabilities was the due from or due to providers also change year to year based on the cost settlements and how those pan out at the end of each fiscal year. So then the net position is the bottom section, $50.1 million as mentioned earlier. Of that, it's broken out into 3 categories. So the first one, net investment in capital assets. That's the $22 million of capital assets above, less the $5 million of debt that's outstanding that was taken to purchase the assets. So we present that as a separate line because it's not really liquid net position or anything that you could use tomorrow in a layman's terms. The restricted amount is for the substance use disorder of $10 million. And then finally it comes down to $22 million of unrestricted net position. That could be used at the board or management's discretion. Move on to the next page is a summary changes in net position. There was a couple main things to highlight here. Revenue was up approximately $40 million from fiscal 22 to fiscal 23, mainly in the Medicaid capitated amounts and then the CCBHC funds that were received. And then if you look down at the expenses section, program expenses were also up approximately $40 million. So we recognize revenue as we provide the service or incur the expense. So it makes sense that program expense and revenue, Medicaid, CCBHC, increased approximately the same amount. And then the administrative expenses increased about $5 million, which brought us down to the $10 million deficit for the year, or decrease in net position. The next two slides we can move through pretty quickly. It's just the capital assets, a breakout here that I touched on earlier. And then the next slide is shows the debt that's outstanding. So there's a lease payable on the mental health services building, then some notes, residential buildings, the breakout there. So I mentioned earlier, we also issued the single audit report and the compliance examination. I would like to also emphasize again that we did issue clean, unmodified opinions on all of our reports this year, and we did not have any findings in the nature of material weaknesses or significant deficiencies or material non-compliance that we were required to report within our audit reports. I believe the next slide is just questions.
Thank you, Jason. And at the outset, I thanked our team for all the efforts that they made, but we also want to thank your team with, I know, all the changes that occur in reporting and things that need to be done and working with our team. So we want to thank you for your efforts.
Well, thank you.
At this time, is there anyone on the board who has any questions for Mr. Kelly?
I'd just like to thank you guys. You know, we received a report last couple of weeks ago from Eddie. Just did an excellent job, and I think that's why the treasurer was able to take the time off to celebrate his grandchild's birth. So you guys did a great job. But thank you. As we looked at some of the numbers, it really, even though there's some deficits we have, but it also shows some opportunities. So thanks a lot. Am I not talking loud enough?
Yeah, they can hear you.
All right. Let me use my other voice. There we go. But thank you very much for that. You know, I had a chance to talk to John as well about it, and I think that it was a great report. Thank you.
Is there anyone else? Yes.
Did you say we've spent $10 million more in 2023 than we did in 2022?
No, not necessarily that. The total expenses incurred during 2023 was $10 million higher than the inflow of revenue during 2023, which resulted in a reduction to your net position.
Okay. So our expenses were $10 million more than our revenue. Okay.
Correct,
okay.
Yes.
Okay, and then the settlements from 2022, is that what you said? Is that how we incurred deficit?
I'll let Eddie speak on this one a little bit here.
No, not exactly. So when we were going through the change in our assets and the liabilities, and in prior year, because of the health emergency that happened, we sort of put a pause on the cost settlement of requiring what the providers, if they owed us, and what we would have received, or for mainly most of them would have been paid out, but we held those balances and didn't settle on them right away. And so going back in FY23, we looked at all the totals that were sitting on our books and then did a final true-up of what should be recognized on our balance. So that wouldn't been the total cause of the deficit that is shown there. I can get the detail that would have caused the change or would have been the changes for the cost settlement.
It just attributed to it then?
Yeah, just a small, probably percentage or dollar amount, but that's not the grand total or the reason for the 10
So
million.
what was the total deficit again for that year, for 2023?
10.9, I believe. 10.9 million, I believe it was.
Thank you.
And which was pretty comparable to where we landed for FY22 as well.
Yes, Dr. Hans.
You mentioned that there is a $5 million increase in the administrative cost, and that is part of this 10 million. Is that correct?
Yes, the administrative costs we did see go up. I believe this question did come up in our previous COW meeting. We're working to bring that detail to the board, line by line item to show the areas that's, causing the increase, because it's not just one particular thing. As we know, we did hire staff. Staff has increased since last year, but there's other things that's happened. Equipment's been purchased. We know we developed or we built our Children Crisis Center, so that depreciation is adding into that total. So it's various factors. So matter of fact, I was working on that earlier today and got pulled on another project. So as soon as we have those details and everyone has vetted it, we'll bring it before the board.
Thank you. I wasn't present at the call meeting, so yeah, thank you.
No worries. Thank you.
Sir, any further questions? I have one. So recently, all of us have read rather prominent stories in the media about the Detroit Conservancy, and the CFO, has been charged criminally with a significant amount of money that was diverted from the organization. The one issue that I kind of focused on, and of course these are only news reports, but had to be with, he set up companies that then he was funneling money to. So we deal with a number of companies. I've listened here to how the number of providers has expanded. Now, there may be, when people come in and their account is set up, some fail-safe to know exactly how that was set up and that they're a legitimate company. But do you have any recommendations or things that you've seen that to ensure that the payment to a vendor is a real payment and not a fabricated payment?
So there are, some of the common safeguards to help vet this situation, is to have process in place to vet new vendors, perform a background, potentially a background or credit check or DNBI check. There's various different checks out there to do on vendors. And then have approval on the setup, multi-layer approval within the organization before a vendor can just get set up in the system. If there's ever an opportunity where there's one person is able to get into the system and set up a vendor, obviously that can open up a loophole in the process. So, multi-levels of review and approval of new vendors, and then obviously if the vendor's not set up in the system, it's very hard to cut a check to that vendor if they're not set up in the system without levels of collusion. So that would be, some of the common safeguards that we see to help prevent that.
Okay. Yeah, and I just thought I'd ask, again, I don't have any comment on what happened and don't know all the facts, but just from reports that I've read, and maybe they didn't have a fail-safe system. So you're suggesting that perhaps there'd be layers where different people would be approving a vendor for payment.
Correct.
I know they certainly, I know we have a system of taking in, the actual payment invoice and making sure that's accurate, but I think, the baseline is that the vendor itself, that entity is an appropriate entity to be receiving payment. Okay. All right. Anyone else? Well, I want to thank you again. Obviously, it's always good news when we have a clean audit. We don't have any material findings or non-compliance. Those are all very important. We have a challenge from budgetary viewpoint with respect to trying to curb the deficits into the future and restore our ISF, and that's the challenge that the board has. But we thank you for your work, and we appreciate all your efforts, and please pass that on to your colleagues at BDO.
Yes, thank you for having me, and also we appreciate all the help and preparedness from Eddie and Patrick and the whole finance team in helping get this wrapped up, by the end of June when it was all due. So thanks again.
Okay, thank you.
Thank you.
All right. Next, we have the consent agenda. Sorry. What's that? Oh, thank you for reminding me. I didn't have it down. Yes, we do have to, as is past practice, we do have to have a motion for acceptance of the audit.
I'll move to accept the FY '23 financial audit.
A motion and support. Is there any discussion? Could we have a roll call vote, please?
Mr. Young?
Yes.
Mr. Furman?
Yes.
Dr. Giles? Yes. Pastor Jones?
Yes.
Ms. Woodruff?
Yes.
Dr. Hans? Yes. Ms. Newman?
Yes.
Ms. Root? Yes. Ms. May?
Yes.
Mr. Torres?
Yes.
Mr. Cohen?
Yes,
Motion carries.
thank you. Next, we have the consent agenda, which is the approval of our board minutes and minutes of the Committee of the Whole and the Citizens Advisory Committee.
Move for approval.
Motion? Support. And support. Is this a voice vote? No? I was hoping. Is it? Yeah, this one I thought was a voice vote. I know. I didn't want to be like a convention where they keep on doing roll calls. No, I'm only kidding. No. That's all right. All right, all those in favor say aye.
Aye.
All those opposed, the motion carries. All right. We have to just make a note to receive and file the May financial reports. We did have those presented. Didn't we have those presented at the COW meeting? Yes, we did. Yes, we did.
We did.
But we didn't do a receive and file, so we will just note for the record that we'll receive and file our May financial reports. Next, we have the citizens, a board report from the Citizens Advisory Committee from Christina Root.
Thank you. Last month I presented the update from the June CAC meeting, and we have not had the July one yet, so no report tonight, but our meeting is this Wednesday at 9:30 a.m. Thank you.
Thank you. Other business, with the resignation of Mr. Landsman, we do have a opening for treasurer, and there's been some discussion that we might fill that position this evening. I think John has been our vice chair, John Young, and I don't know if anyone else is interested, but rather than leave that position open and an officer position of the board, what is the board's desire to fill that position?
I move to elevate John Young to the position of treasurer.
Motion and support. Is there any other nominations? Any discussion? That would also, I believe, make you the chairman of the Finance Committee, the treasurer. I think they both go hand in hand. Is that your intent, Adam?
Yes.
They'd be both positions?
Yes.
All right. All right, we had a motion and a second, and do you want a roll call vote, please?
Is Corona online? I just want to clarify if this just needs the committee, or is this a full board?
No.
So hi, I'm sorry, this is Kalana, legal counsel for OCHN. The board can vote to accept the committee's recommendation.
So the Finance Committee?
Correct.
Okay.
Yeah, the full board votes for treasurer.
That is correct. The full board votes for the treasurer, and once it goes back to the finance committee, someone will need to, if you so choose, to elect a co-chair.
Okay. Well then we can hold off till. Can we do that now on the to appoint chair?
You can definitely appoint. It's an officer position, so the board will be empowered to appoint the treasurer position.
Okay.
At this meeting.
So we'll leave your motion just as treasurer, and then we'll do a roll call vote on that.
Okay. Who supported that? Oh, sorry, I was taking note. Ms. Newman, okay.
Adam, yeah.
Yes.
That's what I thought, but.
Yeah, it is.
Yes,
Yeah.
correct.
Yeah,
All right,
the
then
treasurer is,
Yeah.
yeah, the treasurer is the chair of the, finance committee, yeah.
Then we just vote on treasurer, and you get 2 jobs for the price of 1 vote.
But I think what Klana was clarifying is
Yeah,
he is automatic the chair.
right,
If they so choose, that committee wants a vice chair,
yeah.
then they need to vote on the vice chair.
Right. Well, yeah, and I think we can just act on the treasurer tonight, and we leave the next cow meeting, we can do the vice chair, unless people want to do it right now.
Okay,
Yeah, okay.
okay,
All
that's
right, well, let's go on the motion then for treasurer.
okay. Mr. Furman?
Yes.
Dr. Hans?
Yes.
Mr. Torres?
Yes.
Ms. Woodruff? Dr. Giles?
Yes.
Ms. Newman?
Yes.
Mr. Young?
Yes.
Ms. Root?
Yes.
Pastor Jones?
Yes.
Ms. May?
Yes.
Mr. Cowan?
Yes,
Motion carries.
okay. Is that all right if we hold off on the vice chair for the finance committee meeting?
Yeah, we can.
Yeah, you can go solo for a couple weeks. Yeah, okay. All right, good. All right. And then, there's a note about October meeting dates?
So Karen and I were looking at the meeting dates, and we just want to clarify, because I had on record that our cow meeting date was actually the 14th, got moved back a week. It's just the way the Mondays and Tuesdays are falling. And then the board would be on the 22nd, and then the study session would be on Halloween. So I'm wondering if you want to move the cow up to the 7th and the board keep it on the 15th like it's regularly scheduled, and the study session on the 24th like it would be regularly scheduled. So instead of moving the board and the study session behind a week, we would just be moving the cow up a week.
So the cow would be on the 7th.
Yeah, and then the board would be at the regular 15th, the third Tuesday, and then the study session would be on the fourth Thursday, the 24th.
Okay. All right. Yes.
When is the fall conference?
Hold
I
on,
just
I'm
looked
gonna
it up.
look
It's
that
the
up real-
21st and the 22nd.
21st and 22nd.
Oh, so it's going to be, so that would work even better,
Yeah.
because the board meeting would be on the 15th.
Right,
Okay.
right.
Thank you.
So that would actually align to do that, right? Okay.
Okay.
So we approved the calendar, so I think I need a motion to approve the
So
amended.
to change, I think the appropriate method would be a motion to have the board meeting on the 7th, or the cow meeting on Monday the 7th, the board meeting on Tuesday the 15th, and a study session on October 24th. If we have one, that would be the day.
Yeah.
Okay.
And just a reminder, that's the board organizational meeting month, so
Okay.
that's when all elections happen. So if members are at the CMH conference, they wouldn't be able to be present.
Okay. Well, that organizational meeting happens on the 15th at the actual board meeting, right? Yeah, okay. All right. All right. So do we have a motion?
So moved.
Support.
A motion and support to change the dates of October meetings. Is there any discussion? I think that's just a voice vote. All those in favor say aye.
Aye.
All those opposed, the motion carries. At this time, we have a second opportunity for public comment. Is there anyone online who wishes to speak?
If you are online and wish to speak to public comment, please raise your hand at this time.
There being no one, is there anyone in our audience this evening who wishes to address the board? There being no one, we'll close the second opportunity for public comment. And at this time, we have the director's report by Dana Lazenby.
Good evening. Hopefully you all have a copy of my report, and I'll just go through some high-level items very quickly and answer any questions you may have. July is the time of celebration, of course, for Independence Day, but we also had an opportunity here at OCHN to have Minority Mental Health Awareness Month in an event last week. So the program was really unique, and it was the ability for individuals to talk about access for minorities for mental health care, behavioral health care services. So as you saw earlier today, Cheryl presented at this event, and she did an amazing job. And she didn't really highlight this, but one of the things that Cheryl is an amazing advocate. So since I've been here, she has made a point of advocating for the community, the hearing community, and making sure that we have services and improve access. So I haven't forgotten that she gave me an assignment to make sure that we have more direct service professionals who know ASL working in residential settings. So that's one of the things that we're, Trish and I will continue to work on and advocate for, making sure that we have more direct care workers, more direct service professionals who are competent and can use ASL. The next thing I want to talk about really briefly is our access point, and improving access is one of our strategic goals. So I'm proud to say we actually opened in our walk-in center with Oakland County Health Department and Honors Health on June 15th. It was a slow or soft launch at that point, and so far we've seen a number of individuals. The amount of individuals we've seen who are requesting or in need of mental health services is very low. So we're working with the county as well as Honor to look at how we can increase the numbers and improve community education about that service that's available, and so that people have another point of access in the community. But also, in our work with Oakland County Health Department, they've identified a space for us in their Southfield Health Department, in which we will put an access person who, when they have individuals who come to the health department seeking services, that they can also get engaged in mental health, substance use disorder services if they need. We're also looking at other locations, including Upper Northern Oakland County. Ms. May, we did not forget about your community there, and making sure that if there's an available point in which we can collaborate with Oakland County Health Department or even another provider there. We're really trying to recruit and try to get providers in that community because we know there's a need there that's not being met. The next thing I want to focus on is our work with the Oakland County Emergency Management Department in response to the Rochester Hills shooting. So very proud to do our work there and work with the Family Assistance Center. And as you remember last week, Trish gave an update on the services that are being provided in that center. And we're doing ongoing support as needed and requested by that community. Trish also met with someone from the federal, why don't you fill that piece in?
The Office of Victims.
Thank you.
Yeah, Victims Crisis Center.
To talk about how we can further work together to support the community in response to that shooting event that was in Rochester Hills, very similar to what was done with the Oxford school shooting. So it's ongoing working together, in addition to looking at our crisis intervention stress management team and how we can expand and offer more training and have more of our team involved in responses. We also had the ability to respond to the Layfield Village community shooting that occurred in June as well. So we just, we're looking at opportunities, or not even opportunities, where we're needed. We're trying to go and have a presence there and make sure that people understand our role in the community, but also understanding that we have services and supports available. So even if we show up to that community and they don't take advantage of it, we're able to communicate and give them the information so that they can follow up at a later time. So that was a great collaboration with the local law enforcement and Lathrop Village as well. Let's see what else. As I already spoke about our theme at our Minority Mental Health event on Tuesday, July 9th, the Universal Language of Healing Trauma and Minority Mental Health, big appreciation for the team that put it together, our DEI committee. We had a keynote speaker, Richard Plowden from Hero Circle, who talked about martial arts and how it's been used to help school-age youth in the community, and also children dealing with a cancer diagnosis. So very positive. We also had a presentation from Nature's Playhouse and art therapy. So we were all creating pieces of art that can be used to share a mural, to build a mural, and actually offer hope and support for various organizations and communities. And as I said earlier, Cheryl was one of our prominent speakers at that event as well. Finally, our crisis services, I really want to take an emphasis on crisis services. Our team has worked very closely with Common Ground to look at opportunities for improvement, but also reporting back to this board how we're doing in that area with data. So one of the goals we set for our team is really to come back and show you the data and where we know there may be gaps, directly working with Common Ground to fill some of those gaps and what we need to do to improve our crisis continuum of care. So it's just not checking off, we have a crisis mobile team, we have crisis stabilization services, and we have crisis residential, but how are we doing in those areas? What kind of response and feedback are we getting from individuals who actually go to Common Ground or go to the YFCC seeking support and services? I think there are a few people or a few members of this board that have actually reached out when there have been barriers, and you know, we know how to address those barriers, but that should not be because you know who to reach out to. It really should be a consistent standard response of care. So we want to make sure that we're looking at that and focusing in on those challenges, or not even challenges, I would say real opportunities to improve crisis services and build on that continuum, but also making sure that we have services available in other areas in the community so that people can access crisis when and where they need, but also urgent care services and routine services. So access is a huge piece of that. In terms of integrated health care, I already spoke to our walk-in center, but I also want to stress upon this board that that's just the beginning. We're continuing to work with Oakland County Health Department and the county deputy exec to make sure that we're expanding access, but also working really diligently on some of the challenges related to integrated care. And even in talking about a transition for success, which is really looking at poverty as a disease and how we can address and treat. And it's really based on social determinants of health and how we can really treat poverty helps to heal other things, but also when you're struggling with a mental health or a chronic medical condition, it can also go the other direction and create a situation where the person doesn't have the resources to care for themselves. So with that, I think I've touched upon, two other, probably I would say major, or three other major things that we will be coming to phase one of implementation. One is our claims department. I think I did tell this board a couple of months ago we hired our claims director, and she has hit the ground running. So that department will officially start August 1st, is what the team is promising me after multiple discussions. But August 1st, we will have our claims department where we're going to have staff actually working with that director to begin to process and adjudicate and pay those claims. The other big thing is transportation. We've talked, and I think prior to me even starting here at the organization, transportation was a concern. And we hear you, and I know members of our team have also the same concerns and wanted to see something different with transportation. And so as we opened it up and looked at the data, we know that there are some things that can improve in terms of standardization of rates and how we manage that network of transportation providers and how we separate it out in some of the rates that are built together so that we can really see the cost of transportation, making sure that there's a primary way to get people where they need to be, but also what's the backup plan? And Pastor Jones, you brought up the opportunity to really help our transportation providers think about getting drivers, because sometimes that is a barrier to making sure that transportation is consistently provided. But I think the things that we're doing, and you'll hear more about it, and we're working with the provider network in our forum on Wednesday, July 24th, and also working with Individual Serve on Thursday, July 25th. So those are two opportunities for us to really work with the community and the network of transportation providers. And then the other really big thing, it's a little complicated, but I'll try to explain. Financial management systems, or there used to be called fiscal intermediaries, really work with individuals who have self-directed or self-determined arrangements. So there's a clinical component, there's a budget component, and there's also the fiscal management system who serves as almost as the HR department. And so as part of our contract, we're required to directly work with those FMS, or those financial management services. And so those contracts will be held directly by us starting September 1st, I think October 1st, I'm sorry. So October 1st, we will directly hold those contracts. And what that means is that when we see situations about the payment, which we saw a few months ago, where there was a payment issue with Arc of Oakland, some of those issues will be eliminated. But also, this is, like I said, a contractual requirement of ours anyway, to make those arrangements and to audit those self-directed arrangements and agreements to make sure that the provider of service is not also handling the financial management service provider. So all the things that are required to be like audits and background checks and benefits and things of that nature, that'll all be managed by us here at OCHN. So more to come on that as well. And if you look at my report on Thursday, July 30th, there's a webinar for Individual Serve, because we know there will be a lot of questions and concerns. And then also the provider forum is July 30th. So you're all welcome to attend either one of those. And again, I wanted to recognize our SISM team. Very proud of the work that we're doing. It's sad that we have to be in place, but very proud of the work that we're doing. But it also speaks to the other things that we're addressing in our justice team, and that is the behavioral health threat assessments, really looking at crisis services to make sure that people understand we're available and when to call and seek out support. I think we're seeing situations where people in the community, loved ones, family members, and friends may see signs, but they don't know what to do. So we're talking about that internally and coming up with ideas so that we can present information and proposals to find support. One of the things that we did have in place, or at least we thought we had, was a grant for violence intervention. And part of that grant was pared down quite a bit. And not to say if we had this stuff in place before, we would have prevented this, but the more we can educate the community about what to look for and signs and who to call when they are concerned about an individual, our hope is that and I've said this before about Oxford, that we never see another mass shooting in our community. And it's sad to say we've already seen another one in less than 2 years. So we really are committed to making sure that individuals who have a need and family members who don't know what to do in those situations, or just the community at large, we serve as a resource, and not just a resource, but an actual place where people can be assessed and cared for. So working very closely with the law enforcement community and really having that support and the community support around the table is really critical for us to advocate so that we can have more of those programs and services to address the needs of this community, because we know they're there, but I think many don't know what to do when they see things. So that is it for my report. Thank you.
Any questions? Yes.
I appreciate the work we're doing over there in Rochester. So I grew up in Rochester, right in that area, so in the Brooklyn sub. My wife's family actually still lives there. So I was thinking about, like, when we're reaching out have we reached out to like the city council or to the city to find out if there's anybody like secondary trauma? That's a pretty big neighborhood right there, spans both sides, and yeah, and then down it goes over to John R. That's all part of the Brooklyn sub-neighborhood. And if you go even further down, you got like Brooklands Elementary, you got Ruther Middle School right there. And I know Rochester, it's, people think, it's wealthy, it's Rochester Hills. But I can tell you that area is probably like the less well-off part, because there's a lot more apartments, trailer parks, things like that in that area. So for people who might be in need of help or services, that obviously would be people who would be the populations that we're looking for. So I'm just thinking of that maybe people who haven't reached out, it sounds like we're doing good work there, I appreciate that. But that if maybe reaching out to the city, if we haven't already, the city council, because they separate into districts, so maybe that city council person for that district might be getting some need or help. And then when school starts back up, Ruther Middle School, Brooklands Elementary School, which is assigned to that area, and then I believe it's still Rochester High. Kids that may, have secondary trauma, or even the fact that there was a shooting so close to their home, a mass shooting, and, being scared. So they don't always open up. So maybe when school starts too, maybe we can get in there and provide some services. But I'm glad that we're doing work there and that we're continuing to provide ongoing support. But obviously, that sometimes it's hard to give people help. That's a whole other thing. So.
Well, and Trish is going to speak to the resources, but we do have the Family Assistance Center, but also our school mental health navigators work year-round. So, we can do some more outreach to that community, and I know Trish has worked closely with the mayor and the city council.
Yeah, we're doing weekly meetings with the mayor that we've been doing for the past few weeks, in addition to, we just ended our weekly meetings with the Oakland County Emergency Management. We've been doing events and reaching out in the Brooklands community, whether it's evening events. They had a Brooklyn Strong event, I believe, coming up, and then we also did events at both Ruther Middle School and Brooklands Elementary, where we connected our school mental health navigators. And again, when school is back in session, being able to have them out there and connect with the school. We also went basically door to door to the local businesses surrounding the splash pad. So I had a co-responder out there meeting with all of the businesses that are right there to provide information and provide follow-up for each of those as well. And then we have some communications that are going out, some direct mailers and things like that our communications team is working on to get more of the larger surrounding area as well.
Yeah, because there's a lot of elderly people in those neighborhoods, because that's kind of the thing, those houses are old and those people have lived there 30, 40 years, and the city has just grown up around them. So it's like they still live in those homes. So I think those people would be apt not to, but to seek out the help. And then when school starts, that's good that we're doing that. And I feel like the need will probably go up, because I know even in Waterford, when school starts, it's like the wildest first 2 weeks. Everybody's showing up, and all their problems are like now coming up to the forefront. We're having to make calls and all these kinds of things, resources. So maybe but and the good part is that maybe that's that opportunity where we can help them, or the kids and that just may have a little bit of trauma or secondary trauma from what happened or hearing about what happened. So, but that sounds good. Sounds like we're doing all the right things.
Absolutely, and we'll reach out to do some things throughout the school year at professional development days to help the staff link the kids as well. And then we got a list of a couple hundred events. Rochester does a lot of community events. Yeah. The city put together a list, and we've gone and chosen events. So we'll be there weekly somewhere in the city through August.
Thank you.
I was wondering, with the focus on this, the Call to Solidarity meeting that's coming up, if that would be another opportunity for us with so many different groups, organizations, and persons there to talk about the services that we're doing, like in Rochester, that we have not forgotten what's, happened, in Oxford or what have you. But it may be a great opportunity because we'll be addressing some of that. I think that's how it first started. So maybe, I know Caitlin's working on it with her team, and so maybe we could add some type of recognition to that to show what we're doing, as an organization.
Absolutely.
Any other questions for our CEO? Okay.
Dr. Hans has her hand.
Oh, I'm sorry. I apologize.
I have a couple of follow-up on this subject. Of course, firearm violence is on all of and it is getting, it seems like I was in high school when the last political assassination attempt happened. I was in medical school when and the one in Alabama happened with Senator or Governor Wallace. It appears that the perpetrators are younger and younger people. So in sometime in future, hopefully within this year, we will hear a presentation from our school navigators as to what is the current science and where our focus should be. Because I think that is very important. I was really saddened this year that we are still where we were 50, 60 years ago. So that's one thing. The second thing is a provider, FMS provider forum. Where is this going to be held?
The meeting itself will be here, and then there's a virtual option as well.
Okay, thank you.
And just to speak to what you just said, with the recent assassination attempt, we also sent out information reminding people what they can do when they're, because it's reoccurring. You're seeing these things reoccur. So we wanted to send out information to help people sort of deal with that trauma and re-traumatization, because every time you hear about one of these things, we have to remember the victims prior, it just builds on their trauma. And so I think that's why it's really important for us to continue to put the information out there and let people know how to ask for the help that they need, but also like Trish and the CISM team are doing, they're actually being there. So they're not even waiting for people to ask for us to show up. They're just going. So even with the situation with Lathrop Village, that shooting there, typically we would not show up there, but we wanted to have a response to the community because, again, it's another mass shooting. It happened under different circumstances, but still it led to the shooting of 6 people. So we wanted to make sure that we're, we don't want to spread ourselves thin, but we also want to build up our team, but also look at how do we have a team that's always ready and available. So we have about 2 teams that are, or more, do we? I think we have more. Trish can tell you.
For our CISM?
Yes.
Our CISM team, we have approximately 25 staff trained. And I think it speaks a lot to our close relationship with law enforcement, because it was actually the chief at Lathrop that contacted me. And because we've built these collaborations and these partnerships, not only did we do CISM for the community, we did it for the officers in Lathrop, we did it for the officers in Rochester as well. And so we'll be looking, again, how we expand throughout our providers as well. That was always the plan. But it always seems something happens before we get to execute the bigger plan. So we'll be holding multiple trainings coming up in the next fiscal year to expand our CISM team to our providers and to some of our partner organizations. And you mentioned a little bit about the shootings and the individuals being younger and younger. That's, I think, really builds on what we're already doing with our prevention work with the behavioral threat assessment and management. Dr. Posios and I work really closely together in not just training K through 12 schools in partnership with Oakland Schools and the Sheriff's Office, but our community team that we've launched really looks at that gap between when somebody is out of school and maybe before they're caught in a workplace or a university, but really looking at that and how we build that up, at least within our community, so that we can help to prevent future events.
Yes, so I think my point is that we need to learn a little bit more about what causes this, what are the reasons for this. We see it in affluent, quote unquote, affluent communities, albeit pockets where there is certain disadvantages. I think that would be also, should be our, prevention should also be our focus. Because we can provide, this is a wealthy country. I mean, we should have all these resources, and we are, as a country, are giving people. So that is in our fabric. But it also, when we talk about it like, as if it's all there, it normalizes these things. Also, as if it is given just like any other illness or any other kind of trauma. So that's where I'm coming from.
We do provide the K through 12 training, but within our regional partnership with the FBI, we do a lot around the pathway to violence. And so I could always invite my FBI partners to do a small presentation to you, but we are looking for funding to have a threat assessment coordinator so we can look at doing wide-scale awareness campaigns and trainings for the community.
Yes, we can advocate only if we have solid data, good information to support that, that argument or that request. I mean, retrospectively, we all can say that, yes, it is needed, but I think we have to be educated about this also. And I will certainly benefit from that. Thank you.
All right. At this time, board member comments, and we'll start with Adam.
I'd just like to thank Cheryl for her presentation. It was very enlightening. And I think that just because of the nature of the individuals that we serve, we don't run across the hearing impaired or deaf community very often, so it's very good to hear her perspective and also her perspective on serving more people in that community in the future. So thank you for that. And also the audit report was very enlightening as well. Thank you for all the staff that took time to put together the presentations, and have a good evening.
Dr. Hans?
No, thank you.
All right, thank you.
No comments, thank you.
All right.
I thank you for the presentations on tonight, especially the one related to the deaf and hard of hearing community, realizing that there is such a void, and hopefully with awareness, we can address that void.
Well, I just want to echo the thank you for the presentation, and I won't keep you any longer. Just thank you, and that's about it.
Sarah?
No comment.
Mr. Jones?
Yeah, let me thank Cheryl for just a great presentation today. Not only was it informative, encouraging, but also inspiring. I was really touched by it, learned some things, and I really appreciate your coming and sharing that information with us. So thank you very, very much. 60 years, OCHN. 60-year anniversary, and it's just an attestament to the dedication, the commitment of this group. I keep talking about what a great group this group is, and great group of the workers, the employees, and all of that. And so I celebrate with you in the 60 years on your anniversary and of your existence. So I want to say thank you very, very much for that. And certainly the direction we're going. On this violence thing, I think that's something we all have to think about. And what we have to show is that, we are concerned that there's some things that we personally need to do, and I think we will be doing. But I think it's so very, very important, one, as they say, tone down the temperature. Tone down the temperature. And, I thought the other day, whatever happened to just throwing a snowball at somebody, So maybe we need to just understand that everybody has a right, and that we need to be cognizant of that. But thanks to this board for what you do. Thank you.
Just want to thank Cheryl for her presentation. I guess I would add to her presentation and more homework for Trish. You know, on the autism spectrum, a lot of folks are nonverbal. I can remember having this candidly argument with Joe's teachers coming up that, you know, because Apple was coming out with more technology, and it's like, well, there's always going to be an iPad or something. And I said, yeah, until the power goes out, and then there's nothing. So just getting basic signs throughout the curriculum in the schools, and then also with providers. Doesn't have to be the entire spectrum like Cheryl knows, but, you know, the top 10 signs so people understand it. I think it would help a whole lot of folks. So thanks for the presentation.
Okay.
I just want to thank Cheryl also for her presentation, and it was good news about the audit as well. And with that, I'll say good night.
Cheryl Myers, you are a beacon of hope, and we thank you for your efforts in the past, and we hope you have a bright future and continue to work with us and help those similarly situated. I want to thank the board for all their work the past month. We've been through a few things, and the least of which is the audit. I want to thank John Young for stepping up to the treasurer's position. He has been a very active member of the Finance Committee, and I'm very pleased that the board has given him that role. So we still got work to do as the audit shows, but I think I agree with all of you overall. The audit, the key thing of an audit is that there's the folks we work with and the people we serve can rely upon the financial correctness of what we do. We may be spending a little bit more money than we have, but it's all going to services for the most part. So I think that's still a thing, the challenge that we have. We got the budget coming up, so the challenges never end. So we will continue to work at those challenges, and I'll be pleased to do it with all of you. So at this time, if there's no further business, we will stand adjourned.